In E. coli, P. pylori is present in uropathogenic type. A child with fever with RBCs and pus in stool causative organism is enterohemorrhagic E. coli. In donovanosis, there is pseudo-lymphadenopathy. Vidal test is based on agglutination. Recommended transport medium for stool specimen suspected to contain enteric pathogen is buffered glycerol saline medium. Vibrio cholerae 0139 is first discovered in Chennai. Vibrio cholerae 0139 is epidemiologically indistinguishable from O1L-TOR. Here the clinical manifestations are similar to O1L-TOR. In the small intestine, cholera toxin acts by ADP ribosylation of G regulatory protein. The effect of cholera toxin is mediated via the stimulation of cyclic AMP. The best suited medium for Vibrio cholerae is TCBS medium. A 32-year-old male who recently visited a seacoast presented with ulcer over the left leg. The probable cause is Vibrio vulnificus. Strain of Vibrio cholerae in Bengal is 0:139. Cholera has shortest incubation period. Vibrio cholera can tolerate wide range of alkaline pH. Transport medium for cholera is Carey-Blair medium. Cholera is caused by gram-negative rod. It is an achlorhydria which renders an individual susceptible to disease. The most common form of melioidosis is pulmonary infection. Melioidosis is caused by gram-negative aerobic bacteria. Here, bipolar staining of the etiological agent is seen with methylene blue. A 50-year-old chronic alcoholic male agricultural worker presented with high-grade fever of 1 week with spells of chills and rigor. Examination of the respiratory system reveals bilateral crepitation with scattered bronchi. Multiple subcutaneous nodules were found on extensor surface of left forearm and left leg. Direct microscopy of the pus aspirate from the nodules reveals plenty of gram-negative bacilli with bipolar staining. Culture reveals distinct rough corrugated gray-white colonies on blood agar. The organisms were motile and oxidase positive. The most likely diagnosis is melioidosis. Yersinia pestis is gram-negative non-motile cocobacilli. A farmer presents to the emergency department with painful inguinal lymphadenopathy and history of fever and flu-like symptoms. Clinical examination reveals an ulcer in the leg. The stain used to detect suspected bipolar stained organism in this case is Weissen's stain. This case is bubonic plague and the organism is Yersinia pestis. Here we can see safety pin appearance. Blue pus is found in Pseudomonas infection. Glanders is caused by bacteria. Pyocyanin is formed by Pseudomonas. Pseudomonas toxin acts by inhibition of protein synthesis. In India, outbreak of plague occurred in Gujarat, Maharashtra and also Madhya Pradesh. Ecthyma gangrenosum is caused by Pseudomonas. Most common invasive manifestation of Haemophilus influenza is meningitis. Haemophilus influenza infection, it is a rare cause of meningitis in the first 2 months of life. It needs 5 and 10 factor for growth. Bordetella pertussis is a strict human pathogen. Bordetella pertussis can be cultured from the patient during catral stage. Bordetella pertussis leads to invasion of the respiratory mucosa. The usual incubation period of pertussis is 7 to 14 days. Erythromycin should be given to contacts with pertussis. In Bordetella pertussis, the capsule does not act as virulence factor. Haemophilus influenzae, Streptococcus pneumoniae, Neisseria meningitidis. In these all organisms, capsule act as virulence factor. A cellular pertussis vaccine contains filamentous hemagglutinin and also pertussis toxin. A veterinary doctor had pyrexia of unknown origin. His blood culture in special laboratory media was positive for gram-negative short bacilli, which was oxidase positive. Here, Brucella species is grown in the culture. A farmer presenting with fever on and off for the past 4 years was diagnosed to be suffering from chronic brucellosis. The serological test helpful in the diagnosis at this stage is Coombs test, complement fixation test, and also 2-mercaptoethanol test. Malta fever is caused by Brucella melitensis. A farmer rearing sheep presented with complaints of fever and weakness for the last 1 month. There is general lymphadenopathy. There was also associated hepatomegaly. Biopsy of liver showed non-caseating granuloma. These are most likely due to infection with Brucella melitensis. Brucellosis is a zoonotic condition. Here blood cultures are used in diagnosis. Brucellosis is transmitted via animal products. Brucella abortus is capnophilic. It is transmitted by aerosol which can occur occasionally. Pasteurization destroys it. Milk ring test is for brucellosis. Haemophilus ducreyi causes chancroid. Satellitism is seen in culture of Haemophilus. Tracheal cytotoxin, pertussis toxin, pertactin. These all are virulence factors of pertussis. Bacillus media, CVA medium, Scirrhos medium, Campylobacter blood agar. These all are Campylobacter culture media. Campylobacter jejuni can cause Guillain-Barré syndrome. Poultry is the source of infection. Campylobacter jejuni is a common cause of campylobacteriosis. 35-year-old patient complains of abdominal cramps along with profuse diarrhea. Treating physician wants to process the stool specimen for isolation of Campylobacter jejuni. The method of choice for culture of stool is culture on Scirrhos medium incubated at 42 degrees Celsius under microaerophilic condition. Helicobacter pylori is not associated with gastric leiomyoma. Helicobacter pylori is associated with gastrointestinal lymphoma, gastric cancer, and also peptic ulcer. H. pylori infection remains lifelong if untreated. Toxigenic strains of H. pylori usually causes ulcer. Here culture is the gold standard method. H. pylori is transmitted from man to man, fecal-oral route, and also by orogastric route. Campylobacter is microaerophilic bacteria. Organism which shows strongly urease positive is H. pylori. Infection with H. pylori is common in low socioeconomic status. 85% of the population is affected with H. pylori infection in some developing countries. About 50% of the world population is affected with H. pylori infection. Urease activity of H. pylori provides protective environment to the bacilli. The most sensitive test for H. pylori is breath test. H. pylori causes gastric ulcer, duodenal ulcer, and also gastric cancer. Scirrhos media is a selective media for Campylobacter. H. pylori is a urease positive bacillus. It is highly associated with duodenal ulcer. Urea breath test can be performed only in specialized labs. Campylobacter jejuni can grow at temperature around 42 degrees Celsius. 7-sheathed flagella is seen in H. pylori. A 70-year-old patient presents with high-grade fever, dry cough, and abdominal pain. Sputum sample collected from patient shows gram-negative organisms that are able to grow only on charcoal yeast extract medium. The most likely organism is Legionella. A 60-year-old man is diagnosed to be suffering from Legionella disease after he returns home from attending a convention. He could have acquired it from inhalation of the aerosol in the air-conditioned room at convention center. 28-year-old female has diarrhea, confusion, high-grade fever with bilateral pneumonitis. Organism causing this is Legionella. Legionella can be grown on complex media. Legionella Pneumophilia serogroup 1 is the most common serogroup isolated from humans. Legionella Pneumophilia is not effectively killed by polymorphonuclear leukocyte. Pontiac fever is caused by Legionella Pneumophilia. An elderly patient presented with fever, chest pain, and dry cough. Sputum cultured on charcoal yeast medium. The most likely organism here is Legionella. Aerosol spread leading to epidemics is seen in infection with Legionella. Buffered charcoal yeast agar is the selective medium for Legionella Pneumophilia. Legionella disease is caused by motile gram-negative organism. Lice are not the vectors of Q fever. Lice are the vectors of relapsing fever, trench fever, and also epidemic typhus. Causative organism of scrub typhus is Rickettsia suzugamoshi. Vector is trombiculate mite. Tetracycline is the drug of choice for scrub typhus. A patient complained of chills and fever following a louse bite 2 weeks before. He had rashes all over the body and was delirious at the time of presentation to the hospital and subsequently went into coma. A provisional diagnosis of vasculitis due to rickettsial infection was made. The causative organism here is Rickettsia prowazekii. Scrub typhus is transmitted by trombiculate mite. Endemic typhus, the vector is flea. A man presents with fever, chills 2 weeks after a louse bite. There was maculopapular rash on the trunk which spread peripherally. The cause of this infection can be epidemic typhus. Disease caused by Orientia is transmitted by trombiculate mite. Tick is a vector for Crimean Congo fever and also Rocky Mountain spotted fever. In a patient with UTI on smear, no bacteria are found on gram stain with abundant pus cells. Here McCoy cell line is used to demonstrate organism. Chlamydia has biphasic life. The reticulate body of chlamydia undergoes binary fission. Once it invades into cell, it abates phagolysosomal fusion. The group-specific antigen of chlamydia pneumonia is responsible for the production of complement-fixing antibodies. A 45-year-old female complains of lower abdominal pain and vaginal discharge. On examination, there is cervicitis along with mucopurulent cervical discharge. The gram smear of the discharge shows presence of abundant pus cells but no bacteria. The best approach to isolate the possible causative agent would be culture on McCoy cells. A man presents to STD clinic with urethritis and urethral discharge. Gram stain shows numerous pus cells but no microorganisms. Culture is negative on routine lab media. The most likely agent is Chlamydia trachomatis. Chlamydia trachomatis serovas decay causes urethritis. Chlamydia causes infertility and also pelvic inflammatory disease. Isolation of chlamydia from tissue specimen can be done by yolk sac inoculation. A male patient with symptoms of urethritis, examination reveals only pus cells without any organism. Most likely cause is Chlamydia trachomatis. Most sensitive test for diagnosing chlamydia is nucleic acid amplification testing. The primary site of multiplication of rickettsial organism is in the endothelial cells of small vessels. Rabies and hydatid cyst belongs to Anthropozoonosis. Chlamydia causes trachoma, non-gonococcal urethritis, pneumonia as well as parotitis. Chlamydia trachomatis causes ophthalmia neonatorum, lymphogranuloma venereum and also trachoma. Genital elephantiasis is seen in lymphogranuloma venereum. Neal-Moser's reaction is given by rickettsial infection. Microorganism that does not obey Koch's postulates is Mycobacterium leprae. Chlamydia trachomatis, the causative agent for trachoma, is an intracellular organism. Causative agent of Q fever is Coxella burnetii. Weil-Felix reaction is diagnostic for endemic typhus, scrub typhus and also for epidemic typhus. Endemic typhus is transmitted by rat flea. Bartonella grows in the cell-free medium. Trans-ovarian transmission is seen in rickettsia. Vascular endothelial infection is caused by rickettsia. Chlamydia causes trachoma. Causative organism for chlamydia is psittacosis. Chlamydia is also known as basophilic virus. Obligatory intracellular organism is chlamydia. Weil-Felix reaction is used for rickettsia. Inclusion body is seen in chlamydia. False positive VDRL is seen in Lepromatous leprosy, infectious mononucleosis, HIV, and also in pregnancy. Chancre redux is a clinical feature of early relapsing syphilis. Best indicator for monitoring of syphilis treatment is VDRL. A 25-year-old laborer presented 3 years back with penile ulcer which remained untreated. Later, he presented with neurological symptoms for which he has taken appropriate treatment. Test to monitor response to treatment is VDRL. Non-venereal treponemes are Treponema perteni, Treponema caratium. A bacterial disease with 3 R's, that is rat, rice field and rainfall, is leptospirosis. A sweeper involved with repair work of sewers was admitted with fever, jaundice and renal failure. The most appropriate test to diagnose infection of this patient is microscopic agglutination test. 20-year-old boy has admitted with history of fever, icterus, conjunctival suffusion and hematuria for 20 days. Serological test that is diagnostic for utility is microscopic agglutination test. Wheel-Felix reaction is not used for diagnosis of leptospirosis. Microscopic agglutination test, dark field illumination and also macroscopic agglutination test. These all are used in the diagnosis of leptospirosis. A 25-year-old farmer presented with history of high-grade fever for 7 days and altered sensorium for 2 days. On examination, he was comatose and had conjunctival hemorrhage. Urgent investigations showed a hemoglobin of 11 gram per deciliter. Peripheral blood smear was negative for malarial parasite. The most likely diagnosis is Weil's disease. Lyme disease is caused by Borrelia. Tick-borne relapsing fever is caused by Borrelia dettoni as well as Borrelia hermsii. Leptospirosis is a zoonosis. Man is the dead-end host of leptospirosis. Man is an accident host of leptospirosis. Test used for diagnosis of congenital syphilis is IgM FTA-ABS. The causative agent of Lyme's disease is Borrelia burgdorferi. Organisms that has not been cultured successfully so far is Treponema pallidum. Yaws is caused by Treponema pallidum. Genetic variation are important in Borrelia. TPI is most specific for syphilis. VDRL is not specific for syphilis. IgM test is specific for congenital syphilis. Yaws, Begel and syphilis, these all are caused by Treponema. Syphilis was first identified by Shodin and Hoffman. Serological tests like TPI, TPHA and FTA-ABS, these all are specific for diagnosing syphilis. Most specific test to diagnose syphilis is TPPA. Dark ground microscopy is used for TPI. RPR is done for diagnosis for syphilis. Antigenic mutation is seen in trypanosoma as well as Borrelia. Incubation period of syphilis is 10 to 90 days. Borrelia undergoes antigenic variation due to plasmids. Leptospirosis is transmitted by rat. Stain for Treponema is Fontana stain. Reservoir of Leptospira is rat. Confirmatory test for syphilis is FTA-ABS. Borrelia recurrentis is a vector-borne disease. Mycoplasma have an affinity for mammalian cell membranes. Mycoplasma can pass through filters of 450 nanometer pore size. Mycoplasma can reproduce in cell-free media. Positive cold agglutination test is seen in infections with Mycoplasma. Cell wall deficient organisms are Mycoplasma. Dane's method is used for Mycoplasma. Mycoplasma requires cholesterol for growth. Ehrlichia schiefensis is causative agent of human monocytic ehrlichiosis. HACEK group includes Haemophilus saprophyllus and Haemophilus paraprophyllus. A for Actinobacillus actinomycetum comitans. C for Cardiobacterium hominis. E for Eikenella corrodens. K for Kingella kingae. A 20-year-old man presented with hemorrhagic colitis. The stool sample grew Escherichia coli in pure culture. Serotype of E. coli is likely to be the causative agent. So here the serotype is O157 is to H7. Next question. L form phenomenon is most likely to occur in Mycoplasma. A male patient presented with granulomatous pineal ulcer on right giemsa stain. Tiny organisms of 2 microns within macrophages are seen. Causative organism is Calamantobacterium granulomatous. Streptococcal tonsillitis, diphtheria, and also adenovirus pharyngitis. These all cause a gray-white membrane in the throat. H. pylori infection is associated with the development of gastric lymphoma. Weil's disease is caused by Leptospira indrogens. Bacterial vaginosis is due to Gardnerella vaginalis. Malignant otitis externa is due to Pseudomonas. Enterotoxigenic E. coli most commonly causes diarrhea in developing countries. Malignant pustule is caused by anthrax of skin. Haemophilus influenza requires factor 5 and 10. Haemophilus influenza doesn't affect infants below 2 months of age. Most common invasive disease of Haemophilus influenza is meningitis. Clostridium perfringens is the most common cause of gas gangrene. Here, food poisoning strains produce heat-resistant spores. Clostridium perfringens shows positive Nagler reaction. Tetanus transmission is through contaminated wounds and injuries. Here the reservoir is in soil and intestines of humans and animals. In tetanus, no herd immunity or lifelong immunity. Next question. A 35-year-old laborer 3 years back presented with single indurated pineal ulcer not treated. Later he presented with skin rash with neurological symptoms for which he got treated. Test to monitor response for treatment is BDRL. Characteristic of Bacillus cereus food poisoning is presence of pain abdomen. Most common cause of antibiotic-induced colitis is Clostridium difficile. The most common cause of non-gonococcal urethritis is chlamydia. Causative agent of granuloma inguinale is Calamantobacterium granulomatous. Buruli ulcer is caused by Mycobacterium ulcerans. Painful genital ulcers occur in herpes genitalis and also in chancroid. Pneumonia can be caused by Chlamydia psittaci. Brucellosis, anthrax and leptospirosis, these all are zoonotic diseases. Lyme disease is caused by Borrelia burgdorferi. Listeria monocytogenes may cause spontaneous abortion and stillbirth, multiple organ abscess as well as meningitis. A disease seen in severe workers is leptospirosis. Man is the terminal end for tetanus. Bartholinitis is caused by gonococcus. Fry's test is used to diagnose lymphogranuloma venereum. A biological false positive reaction for syphilis is most likely to occur in malaria, leishmaniasis as well as tropical eosinophilia. Disease which can be transmitted by milk is Q fever. Bubo is seen in lymphogranuloma venereum, plague as well as filariasis. Scalded skin syndrome is caused by Staphylococcus. Granulomatous infantiseptia is caused by Listeria. Corynebacterium, Candida and also Vincent's angina. In all these conditions we can see membrane in the pharynx. Malignant pustule is associated with Bacillus anthracis. Eaten agent is Mycoplasma. Acute osteomyelitis in children is most often caused by Staphylococcus aureus. The organism most commonly implicated in subacute bacterial endocarditis is Viridin streptococci. Indicators of water pollution are Escherichia coli, Clostridium perfringens and also Streptococcus faecalis. Scrub typhus is spread by mite. Fatal septicemia is caused by group B Streptococcus. Erythrasma is caused by Corynebacterium minutissimum. Porter's disease is a synonym for cutaneous anthrax. A child with pyoderma becomes toxic and presents with respiratory distress. His chest radiograph shows patchy areas of consolidation and multiple bilateral thin-walled air-containing cysts. The most likely etiological agent in this case is Staphylococcus aureus. A 73-year-old woman with history of diabetes presents with left ear pain and drainage of pus from the ear canal. She has swelling and tenderness over the left mastoid bone. The causative organism here is Pseudomonas aeruginosa. Horizontal gene transfer process includes conjugation, transduction, transformation. A patient with fever of 103 degree Fahrenheit, bradycardia and leukopenia probably has typhoid. The most probable organism causing food poisoning in a child who has eaten ice cream 16 to 18 hours earlier is Salmonella typhimurium. Mycobacterium tuberculosis is a strict aerobe. RPR card test, CAN test, and also VDRL. These all are used for monitoring efficacy of treatment in syphilis. Swarming growth is given by Clostridium tetani. Tryponims can be visualized by fluorescent microscopy, silver stain, and also by dark field microscopy. Vibrio parahemolyticus, Vibrio alginolyticus, Vibrio vulnificus. These all are bacteria which are halophilic. Tumbling motility is seen with Listeria monocytogenes. Diseases transmitted by louse are trench fever, epidemic relapsing fever, and also epidemic typhus. Recrudescent infection is seen with Rickettsia prowazekii. Acquisition of penicillin resistance in Staphylococcus is due to transduction. Most common cause of UTI in pregnancy is E. coli. Clostridium perfringens causes gas gangrene. Clostridium perfringens causes food poisoning. Clostridium perfringens produces an exotoxin that degrades lecithin and causes necrosis and hemolysis. Species of Treponema cause syphilis and yaws. Species of Treponema are a part of normal flora of mouth. Species of Borrelia cause a tick-borne disease called relapsing fever. Ticks are vectors of transmission of the following diseases like tularemia, Lyme disease, and also Rocky Mountain spotted fever. CAM test is used for the identification of group B streptococcus. Staphylococcus aureus, Pseudomonas aeruginosa, and Enterobacteriaceae. These all are common cause of nosocomial infections. A 30-year-old male patient has a large spreading and exuberant ulcer with bright red granulation tissue over the glans penis. There was no lymphadenopathy. The most likely causative organism is Calamity-Bacterium granulomatous. McFadden reaction is seen with malignant pustule. Panton-Valentine toxin is produced by Staphylococcus. Anton's test is used for Listeria monocytogenes. Oils and grease are sterilized by hot air oven. Most common cause of septicemia in patients with sickle cell disease is Streptococcus pneumoniae. 42-year-old wig manufacturer who was involved in inspecting herds for raw material initially experienced only mild upper respiratory tract symptoms, but 2 days later he was brought to the emergency room with fever, severe dyspnea, cyanosis, and tachycardia. Blood cultures were done, and after 16 hours of incubation, the smears revealed large gram-positive rods with subterminal spores. The organism was non-hemolytic on blood agar and non-motile. The most probable organism in this case is Bacillus anthracis. A patient who recently returned from a camping trip is hospitalized with high fever and prostration that recurs every 5 to 7 days. Loosely coiled spiral shaped organism 10 to 20 microns in length are noted in a right stained smear of the patient's blood. Most probable etiological agent is Borrelia hermsii. Next question. 16-year-old girl was admitted to a hospital because of hypotension, cyanosis, high fever, and bilateral non-fluctuant inguinal and axillary lymphadenopathy. The patient died on the same day. Blood cultures obtained on admission were positive for bipolar staining. Short gram-negative bacilli was seen here. Most probable etiological agent is Yersinia pestis. Ixodes species is the arthropod vector of Indian tick typhus. The anti-streptolizin O titer is raised in infections caused by Streptococcus pyogenes. Staphylococcal food poisoning is caused by ingestion of preformed exotoxin. The infectious stage of chlamydia is called elementary body. The spirochetes include the causative agents for both syphilis and Lyme disease. Streptococcus contributes to plague, caries, gingivitis, and periodontal disease. A bacterial culture with a starting density of 10 raised to 3 cells per ml is incubated in liquid nutrient broth. If the bacteria have both a lag time and generation time of 10 minutes, the cell density at 30 minutes will be 4 into 10 raised to 3. In the management of leprosy, lepramin test is most useful for prognosis. A 60-year-old man is diagnosed with carcinoma colon and is scheduled for surgery. He develops persistent low-grade fever and constitutional symptoms. Physical examination is unremarkable other than a heart murmur not previously present. Outpatient blood culture showed gram-positive non-hemolytic cocci. The most likely cause for this clinical picture is subacute endocarditis caused by Streptococcus bovis. A diagnosis of diphtheria is confirmed by demonstration of toxin production by a suspicious isolate. A 20-year-old male had pain in abdomen and mild fever followed by gastroenteritis. The stool examination showed presence of pus cells and RBC on microscopy. The etiological agent responsible is most likely enteroinvasive E. coli. Anti-tubercular drug susceptibility can be done by resistance ratio method, molecular method, and also by radiometric broth method. Defective electron transport chain is seen in small colony variants of Staphylococcus aureus. Small colony variants of Staphylococcus aureus grow as small, non-pigmented and non-hemolytic colony on blood agar. Small colony variants of Staphylococcus aureus fail to express several putative virulence factors. Cefoxitin disc diffusion is a better indicator of the presence of MECA-mediated resistance than the oxacillin disc because of the hyperproduction of beta-lactamases by borderline oxacillin-resistant strains of Staphylococcus aureus. A 10-year-old male child develops fever with signs of toxemia. BACTEC blood culture is negative at 48 hours. Throat examination revealed a white patch in the posterior pharyngeal wall. Gram-stained smear of the throat swab collected shows gram-positive rods. Optimum iron concentration of 0.1 mg per liter is essential for expression of its virulence factors. The macromolecule which is important here in iron metabolism is siderophores. 45-year-old female presented to OP with carbuncle in the back of the neck. The pus culture showed CA-MRSA. Here, CA-MRSA is more virulent and less resistant. An outbreak of bacillary dysentery due to Shigella species has occurred in the neonatal ICU. The epidemiologist has requested the microbiologist to carry out typing of the organism to identify the source. Serotyping would be applicable in outbreaks due to Shigella dysentery, Shigella flexneri and also Shigella boydii. The typing method for this case is colicin typing. Slide coagulase test must be confirmed with tube coagulase test. Rabbit plasma with EDTA is the recommended media. Staphylococcus intermedius and Staphylococcus schliefferi may produce coagulase enzyme. Rapid tests for detection of methicillin resistance are cycling probe amplification, fluorescence technique and also latex agglutination. Vancomycin intermediate Staphylococcus aureus, that is VISA, is an emerging infection. The MIC of vancomycin for such strains as per CLSI guideline is 8 to 16 microgram per milliliter. Fibrinogen binding protein in Staphylococcus epidermidis is responsible for colonization and establishment of infection in the absence of foreign bodies such as catheter or stent. Cell wall plays an important role in adherence. Central role in promoting initial adherence of group A beta hemolytic streptococci to pharyngeal epithelial cell is M protein. Streptodornase cleaves DNA. Streptolysin O is active in reduced state. Pyrogenic toxin A is plasmid mediated. Pneumococci strain isolated from conjunctiva are non-capsulated, rest all are having polysaccharide capsules. Empyema is the most common complication of pneumococcal pneumonia. Austrian syndrome is an occurrence in pneumococcal pneumonia. A patient of rheumatic heart disease developed infective endocarditis after dental extraction. Most likely organism causing this is viridans streptococci. HLR strain is seen in enterococci. Expression of VAN-A gene in enterococci leads to inducible high-level resistance to vancomycin and teicoplanin. A 2-year-old boy is hospitalized with Staphylococcus aureus pneumonia. He gives history of similar bouts of bacterial infections in the past. He had recovered uneventfully from measles 6 months ago. On examination, scanned tonsillar tissue is noted with no lymphadenopathy. Immunoelectrophoresis reveals subnormal levels of gamma globulin. Nitro-blue tetrazolium and chemiluminescence assays indicate phagocytic killing. The most likely disorder the child is suffering from is defect of BTK gene. A 12-year-old boy develops glomerulonephritis a week after he was treated for sore throat. The causative agent is identified by serotyping of the M proteins. Some features about Mycobacterium tuberculosis. Type specificity is due to protein antigen. Tuberculin from human, bovine and murine bacilli is indistinguishable. Antibody are irrelevant in immunity. RF, LP and IS fingerprinting are used for epidemiological typing of Mycobacterium tuberculosis strain. Gamma interferon release assay is useful for diagnosing latent tuberculosis. Enterobacteriaceae are motile only by Peritrichus flagella. They can be non-motile, capsulated or non-capsulated. Enterobacteriaceae reduces nitrate to nitrite. Here we can see catalase positive as well as oxidase negative reactions. Brucella abortus is capnophilic. Brucella is transmitted by aerosol which can occur occasionally. Pasteurization can destroy Brucella.